If that was your fire alarm, oh my god. I might have to introduce the whole YouTube video, I think. Let me see. I'm just doing a one take. Yeah, that's me right there. Like, I'm going to speak into the microphone. Good afternoon, good evening, good morning, my people. This is a slightly different YouTube video today because I am on the Cats Protection podcast. It's Cat's Got Your Tongue. And we are doing a listener special.
We are,
yeah, a listener special. We're doing some feedback and some questions about cats. So stay tuned. It's going to be a long one this time, but I'll try and cut it up as best as I can. And I hope you enjoy it.
Hello, welcome to Cat's Got Your Tongue, our feline-friendly podcast in association with the charity Cats Protection. I'm your host, Adam Brown, and let me just tell you, cats are my best friends. I've got no qualms saying that to you. I absolutely adore cats, which is why this podcast is such good fun to present. Now, in each episode, we chat to celebrity guests. We hear all about the cats in their lives, and we also attempt to tackle your cat questions and queries too. Now, obviously, we've established throughout this series that I do love cats, but as they say, every day's a school day, and there's always so many new and exciting and interesting things we can learn about the world of cats, which is why I've got Nicky here with me, as always, who's our resident cat expert from Cats Protection, and what she doesn't know about cats isn't worth knowing. There you go, that's a big build-up for you then, Nicky, isn't it? No, it's true though, like, honestly, like over the past, several episodes we've done of this podcast, the amount of things that I've learned just from your insight is like, you're to a whole new world about cats.
Thank you.
So
That's great.
How are you today? All right?
Great, thank you. How are you doing?
Yeah, not too bad. I've got a little bit of a cat-related dilemma of my own. My cat Ruby, who's like my daughter, she's got some quite bad knots at the minute.
Oh, yeah.
Yeah, so she's booked in with a groomer because last time she had to actually go to the vets and she had to have the shave.
The full shave,
yeah. And the vet did say to me, listen, it won't look great. We're just going to shave it all off. I was expecting, like, you're not going to feather it in and, make it look on. Like, no.
No, we don't do that at the vet, sadly. It's just for one length.
Yeah. So, Nicky, you're on hand as always to answer any queries and offer advice on your cats. And also, there's no such things as stupid questions. So if you're listening to this podcast and you've got anything you want to ask about your cat or the world of cats, then get in touch. We'll do our best to help you. pod@cats.org.uk is exactly how you do that. We also want to hear your funny stories. Let's face it, everyone loves a cat story, don't they?
Yeah.
And cats are the most entertaining animal ever, in my opinion. Cat-related dilemmas, something we like to call your cat's tales. We're doing that a little bit later on in the podcast today. We'll be going through those later with this week's special guest, who I'm so excited to have on the podcast. Should we introduce him, Nicky?
Definitely.
So each week on Cat's Got Your Tongue, we're joined by a guest who loves cats just as much as I do. And today's guest knows more about small animals than most people because you'll have seen him on TV plenty of times. It's the wonderful Dr Bolu Eso. How are you?
Hey, I'm fine, thank you.
Good. I was so excited to have you here, by the way. So excited to.
I'm excited to be here.
Sit down and talk all things cats with you.
Let's get it.
Because I know you're super passionate about it as well. And today, of course, this is a special episode as well, which is why we've enlisted your help, Bolu, because we're going to basically get into all the questions that listeners have sent us throughout this series. So there's loads of different questions covering all manner of things related to the world of cats. So are you ready to take on the challenge?
Bring it on. I'm flattered. Let's go.
So I think the best way to start, as we always start with our guests on this podcast, is a little bit of a quick fire kind of round. It's not a quiz show, but you know what I mean? A little bit quick, just to get a bit of insight into you a little bit more.
Okay.
Obviously, we deal with cats regularly with your job. Yeah. Are you a cat owner yourself?
I'm not a cat owner.
Have you ever been a cat owner?
No, close. Close.
Close.
Yeah, close. With my job, it's always close.
Oh, of course. Yeah,
Everything comes in, you want to adopt it, you want to take over it. I mean, there was one cat, I'll go real quick, but there was one cat that came to the practice. It was a stray, a kitten, really small. It's a black and white, like cow cat. And he came in and the girls were like, you can't leave him here. It's a Friday and nobody's here on Saturday and nobody's on Sunday. He has to go home with somebody. And everybody's like, Bolu, you live alone. And I was like, oh, okay. And I took him home and funny enough, like we spent 24 hours together and we had like an amazing time. I made like a whole montage of it, put it on social media, and literally I've never had so much feedback on people pressuring me to foster a cat in my life. Like it went super viral, like in like 5 to 10 million views or something like that. Oh, wow. My inbox was flooded with people saying foster fail, like keep him. And I was like, I can't. I had to make like this apology, like I can't keep him because like even though I really do enjoy his company, I don't have the lifestyle to permit for him right now. So that's how close I got to being a cat owner. His name was Green, and he lives with his new foster mum at the moment. That was how close I was to fostering.
But could you see yourself eventually being a cat owner?
100%.
Like when your lifestyle changes and it slows down a little bit, yeah?
100%. Cats are like, as in, I would happily, if I got a nice big house and I slowed down from work and I wasn't always out, Yeah, I'm a cat man all over.
Yeah. So you will have one day.
Oh yeah.
Or maybe
It's
more than
inevitable.
one. Or maybe more than one.
Yeah, it's inevitable.
So, what do you love about cats so much? Because even though you're not a cat owner, I can tell just by, the passion that you have when you talk about cats or when you mention cats. What is it about them that you love?
Do you know what's? I think as a vet, I don't know. Weirdly, I get a passion whenever I talk about any animal. So I could fool anybody. If you told me like iguanas, I'm like, oh my god, yeah. Like, what's not to love about iguanas?
Yeah, that's a different podcast. That, yeah.
Iguanas got your tongue. Yeah.
The spin-off.
Yeah, exactly. But generally, like, I think I started off quite early in life. Most people, like, as a dog person, I generally love dogs a lot. And then as I came into my vet career, you come into contact with a lot of cats. And it's like, I just really want to understand their behavior and how they think and all that stuff. And the more I started to learn about them, the more I started to realize that cats aren't little dogs, they're cats. And there is a reason why cats are worshipped. Like, there is, like, they're really magnificent, they're amazing beings. And the more you learn about them, and the more, like, they're actually elite. Like, they're pretty, they're pretty elite. Like, the fact that they go around stuff, the way they manage themselves, the way they can, like, almost to a point take care of themselves, but I don't like to enforce that too much because then people almost kind of neglect them. But
They got skills.
they got skills, like, and you're just like, I respect it, I respect
Me
your hustle
too.
cats, like, I like that a lot. So yeah, I rate a cat.
I love that. It's a moment you go, yeah, they're elite. They're elite. Yeah.
Just elite, top shelf.
We love that, don't we?
Yeah. So, I mean, what do you say are the most sort of common issues that you see with cats that you treat? Is there something that happens a lot?
Yeah, I think the big thing about cats is husbandry, because husbandry leads to a lot of other issues that we see, like health complaints. And number one thing I probably see a lot with health complaints in cats will probably be lower urinary disease, so lower urinary tract disease. So that's like cats that get blockage, can't urinate. If you've got a male cat that can't urinate, that can often become a medical emergency. So we see them a lot, and that's what we call a blocked cat. So we have to intervene quite quickly, quite rapidly, otherwise they can possibly die. So that is something that we see a lot. And then for me, I'm a big advocate for dentistry, and I will absolutely kick myself in the foot if I did not talk about dentistry, because dentistry, we don't talk about dentistry in our pets enough, especially considering how much we have a great relationship with our pets. And dogs are already the poster boys for dentistry. And cat dentistry, like, we need to look in our cats' mouths, because they have so many issues with their teeth that people completely miss, because they're just like, oh, he's eating or she's eating, oh, they're fine. But really, they're suffering with some serious pain in there, and they're just eating, but they're going through it because it's instinctual for them to eat. It's a survival tactic for them to eat, but they get a lot of pain because they get what we call resorptive lesions, where part of their tooth resorbs. And because the part of the tooth resorbs is basically like a hole in their tooth, and it becomes very painful because the nerves are exposed, the bone's exposed, and it's like, but they just get on with it because they're so hardy, and they tend to hide things as well. So dentistry is another big thing. So every time I see a cat with like a dental issue, or actually other way around, every time I see a cat, majority of the time they have dental issues, and so I have to pick that up on the owner and then push them to go and get their dentistry checked and get their teeth
and
checked.
I
and
imagine
all that
often the owner doesn't even know.
They don't.
No.
Everyone's like, oh, he's been fine. Oh, he's eating. But I'm like, when you look at me, is he eating on one side of his mouth, or does he kind of just graze at the hard food and put it down, and then does he just lick the gravy, or does he just kind of like, just nibble at the soft food? Then there's all kind of signs that his mouth kind of hurts a little bit. So
yeah, Nicky, because obviously, there's probably some telltale signs, but they are quite hard to spot, I imagine.
Yeah, definitely. Well, like Bolu said, like, there's a lot of the times grinding's another one. Where you hear that kind of grinding on one side.
Yeah.
And you hear that you can actually mix the sound, but it's really hard because they do have to eat. The thing I find as a vet nurse, and having worked with cats in practice, is people really worry about taking their cats in for a dental and having extractions. However, once very quickly they've recovered from having a few teeth out, people are amazed at how well the cats do with eating. But not only that, it brings like a new spring in their step. Like, they're more playful, they're happier in themselves. Like, it just improves their well-being so much that people are like really shocked at the transformation, and then it makes them really think, oh gosh, that's how much pain they're in before.
Yeah.
And you just don't realise it, because as you said, cats, it's so subtle.
Yeah, and the fundamental thing we're addressing there is the pain, because they have pain in so many different other parts of their life, that the mouth, once you ease that away from them, they start feeling amazing. And I always say the best dental patient is a dental patient with no teeth. once they got no teeth, there's no problems, right? And people always tell me, well, how they eat. They find a way. They always find, because if they're eating, like, I don't know if you've ever had a toothache. I've had a toothache before. And I was in university, I had a filling. I had a childhood riddled with sweets, so I used to have bad teeth. And I had a filling that fell out, and it meant I had a hole exposed in my tooth. And that pain, I was drumming my head against the wall, literally, I would like ram my head against it because it was a lot better than dealing with the pain. And they get that pain and they're still eating. So imagine once that pain's gone, they're so much better for it. So it's one of those things I tell people to look at a lot.
I had a wisdom tooth extracted, and I sort of moaned for about 2 weeks solid to my mum. I had to go home to my parents' house because I was like, I couldn't go up on my own. And this is only 2 years ago, by the way. I had to go home and say to my mum, will you just look after me, please? She was like, what's happening? I've had a wisdom tooth. I was like, all right, okay. So yeah, you can imagine what our cat would feel.
Definitely. And the worst thing about cats is they hide pain.
Yeah.
They hide pain, they hide stress, and everyone's like, oh, they're fine. Because it's so subtle, the little signs they show us.
So have you got like a main bit of advice that you could sort of give cat owners to make sure they keep the cats fit and healthy as possible? Is there just like what's the one thing that you would kind of advise that maybe people overlook other than the dental kind of side of things?
It's a trigger if you're asking me for advice, because I just start going down a rabbit hole. Main bits of advice to make sure, look, it's hard to incentivize cats to live a fit and healthy lifestyle. Like, it's hard to do that because obviously with a dog you can take him to the park and you can run them around. And cats, if a cat doesn't want to exercise, it's pretty tough to like, okay, come on, like, put the steps in. He's just going to look at you and walk away. So a lot of it is, as an owner, you have to be really on it when it comes to feeding and restricting feed or controlling how much food you're giving, but also being aware that your treats add on to it as well. So making sure you're accounting for how much you're adding with treats. Being careful with the whole leaving dry food out for them 24/7, because even though cats have evolved to eat like 15 to 20 meals in a day. But even though you're leaving food out for them, you have to also bear in mind that a cat, if it was in the wild, even though they're not in the wild anymore, if they're in the wild, they would have a lot of failed attempts at trying to get prey. So they're working for their prey, right? Yeah. They're always constantly working and they're exercising, they're fixating, they're constantly burning the calories. When they're in a home lifestyle, they're not doing all of that stuff. So the fact that there's an ad libitum bowl over there that just an all-you-can-eat buffet, they can just keep going back to, they're going to keep going back and forth and eat it. And the biggest problem is obesity. That is the huge one. So if you want them to live a fit and healthy lifestyle and for a long time, which all of us want, stay on top of their diet. Really stay on top of their diet. And then the rest of it is just understanding how they communicate with each other, how they communicate with your surroundings as well, because, litter trays is a big one, and making sure there's enough litter trays in the house and tending that to the cats as well, and environmental enrichment, because that keeps them fit and active. Regular vet checks, come and see me often, at least twice a year, and I'd say if they're over 7 years old, make sure you get them screened for blood tests, because especially if they're indoor cats, they may be more predisposed to a lot of hormonal conditions as well, which we can't detect unless we do bloods. And if we don't do the blood test, then we won't detect it. And especially after 7, we've got this increased incidence of them getting, thyroid issues, diabetes, high blood pressure. And these are all things that we can't check unless we do the more invasive tests. And I know that veterinary care is more expensive, but these are things that if we catch them early, the cat can be swimming for the rest of their life. They're sailing for the rest of their life. They can be really well looked after. But if we catch them late, that's when things get difficult.
Yeah.
And so, those are big things to keep your cats fit.
I do leave out dry food all the time.
But I was going to catch you.
No, but it's... I imagine quite a lot of cat owners do, because my issue is if I'm out during the day, then obviously she'll have the 2 main meals where she has wet food and dry food. But then my worry is that, like, if I'm not there, she needs to still have something to eat. Yeah. But she does graze throughout the day. Yeah. And like you say, it's like an all-you-can-eat buffet, but if I go to that, I'll do a 5K before I go. So she's not doing that, is she? So
and that's a big thing. Do you know what? Food is a really delicate subject for us, I think, because as people, we show affection through feeding, right?
Yeah.
Like food is so personal to us. So even when I'm discussing with owners that your cat's a bit fat, it's like, I can never. But I'm like, okay, not fat, more cushion for the pushing. But like, it's like, you need to kind of work and trim it down. But it's because it's personal to us, and we really think it reflects on us how we feed our cats or how we feed our pets in general. And I'm always like, look. Honestly, it does no harm if you take away that food and then you feed them in the evening, because once they're overweight, even just a little bit extra, it means that extra weight that they have for the whole year is so much more that you can push. Like, it's so much harder to get rid of that extra weight, because it's so hard to get them back to normal weight when you've overfed them just a tiny bit. Like,
the main thing is about having the 24-hour allowance for that individual cat and working that out with your vet nurse. And then as long as you've not gone over that, and you could probably leave that down, and then once it's gone, and then until the next day, and then they get their new allowance.
You say that I don't do that, but I don't know because I didn't know.
Yeah,
That's okay.
Yeah, like
that's fine.
I was just like, oh, a bowl's empty, let's fill it up.
Yeah, and so many people are like that as well. They're just like, oh yeah, he grazes.
Yeah.
And I'm like, do you measure how much? Nah, just make it full. And I'm like, nah. Well, like if you think about us and we just had like an unlimited store of candy, we probably will keep going back to it.
I do. Yeah, 100%. Yeah.
Exactly. And the thing is that especially when they're indoors or if they're not particularly got any particular incentive to exercise a lot, they're just going to keep... The only exercise they're going to do is when they get up to walk to the food bowl and then back to wherever they're going to sleep and then back again.
Yeah.
Right? So,
it seems so obvious though, like now we've said it, but it's... Yeah, maybe I need to calculate how much you should be having and actually do that, weigh it out and things like that. Because it's easy to do, isn't it? You know what I mean? Like I say, then you know exactly how much she's having each day.
Exactly.
I mean, luckily she's actually, visually looks like she's in okay shape and stuff, but I don't know. I'll be checking the teeth when I get back, I'll tell you. So one more thing as well, Bolu, before we move on to answering some questions that have been sent in by the listeners of Cat's Got Your Tongue. You know when you're sort of treating a cat,
yes.
do you have like a voice that you do?
You expected me to demonstrate?
Do you do it? Because obviously,
voice.
Obviously it's like super professional, but at the same time, it is a really cute cat that you'd be treating.
You know what? Actually, I think I'm actually very. I don't think I have a cat voice. I think I just talk to them really
professionally?
Yeah, professionally. They're my clients after they. So I'm like, I'm doing.
To see you, sir.
Yeah,
exactly.
I'm not gonna lie. I'm actually like that. I'm like, oh, hello, kind sir. Very nice to meet you. Can I take your blood? Thank you very much. And there's a lot of that. Like, to be fair, what's strange, I think, about my relationship with cats, especially in the practice, is I actually ask them, is it okay for me to do this? Like,
Yeah.
Like with dogs as well. To be fair, I do it with dogs as well. But it's like this kind of. Is it okay if I take it? I'm going to take this paw now. Is that all right?
Well, there is a bit of a voice creeping in there.
It's creeping.
Yeah.
The picture's coming in, but it is very much like we're just constantly having a conversation.
Yeah.
All the time. I ignore my nurses, and I'm just like, hey, the cat.
So there you go.
It's coming.
And when you become a cat owner, there's no going back
100%.
then. Yeah.
Have you got a generic nickname for cats?
No,
or pets when you're in practice? So you've forgotten their name?
Yeah.
Which happens. A nickname.
Sometimes. No, I'm actually really bad I do the opposite. I know their names, but then I nickname the names that they have. So like, I had a dog called Wilson and I called her Wilsden Junction and Willie and I'm like, okay, and the cat comes in, it's like Mozart, so I'll call him like, I might say Wolfgang or Amadeus or like, I always just find a way to make it not their name.
Yeah.
They're just like, how do you know we call him that? And I was like, I just nickname everything. So.
You're going to be such a great cat owner because that's like you have about 20 different nicknames for your cat. That isn't none of them the actual name of the cat either. So, Bolu, you're staying with us. We're going to move on to our cat's tales next on Cat's Got Your Tongue. Welcome back to Cat's Got Your Tongue. My name's Adam Brown, and now it is time for your cat's tales. This is where we get to hear from you with your feline disasters, your success stories, questions, pretty much anything cat related. Really, we're here to help. Now, Dr Bolu, have you got a cat's tale for us?
Oh. So many. I think when they come into practice, I hear all sorts of things about people with cats. And a lot of people will tell me about how prolific their cats are at hunting.
Yeah.
Really good at hunting, amazing hunters. And I hear all kinds of stories about people bringing in, their cats bringing in squirrels and mice and pigeons and hedgehogs. And
is it a gift though, Nicky? Is that a bit of a common misconception that it's like a gift to the owner?
Well, yeah. So I think the gift idea was about 15 years old, and that's certainly what people used to think. Whereas nowadays, and again, things can set to change. That's the beauty of science. But at the moment, we're thinking it's more about bringing prey back to the core territory, which often involves the house, and it's where they feel safe and secure to have prey. So. It's hard because it's one of those ones I feel that people tolerate it because they think it's a gift, and if they find out it's not, they're like, ugh, that was a straw that broke the camel's back. But my random fact about prey is shrews taste horrible, so that if they catch a shrew and bring it back, they won't eat it, generally speaking, because they taste nasty. And there's actual studies where they've looked at shrew meat versus field vole and wood mouse. And they
so they just leave that, and
they leave that because it tastes horrible to them.
Yeah,
you'll have to taste. That's interesting, actually. Maybe it's just something to do with the shrew's diet.
Probably because they're insectivores. That's the other thing. If you find a shrew in your house, you haven't got that long to get them back outside because they're more likely to die compared to a mouse.
Right. Okay. That's another great reason for having a cat is that mice and stuff like that.
Really?
Yeah, I'm really, really jumpy with that.
Oh.
Really jumpy.
I'm Oh, so you need my mouse trick, which is, because I'm quite good at catching mice. I pride myself on that. Just a welly boot. Honestly. So you use a welly boot, as long as you're okay with this, by the way, I should point out to our listeners. So I just use one of my own welly boots, and you use it almost as a tunnel. So it's in a nice, dark, safe place for a mouse to run into. And then you make sure you do it along the skirting boards and things like that, because they're never going to go out right into the open. They're sort of more agoraphobic like that. So they'll go along, and as long as you've got to do a few wellies if I know they're under something, and then they'll go into that, and then I can usually take the welly boot outside and then gently tip it outside. Gently, get out there, and then they jump off and they're fine.
That's such a better method than my current method, which is just
scream,
moving back into mum and dad's house.
Honestly, pack up his bag.
I've moved out of flats before when I've seen a mouse and I'm gone, well, that's me done. I have to leave. Honestly, I've done it before. Yeah.
So if I was more local, I'd have just come round and sort it out for you.
Well, now, and all this time, all I needed was a pair of wellies. Unbelievable.
All you need.
I'm a very hands-on. Like, I'll just sit.
This is why you get people ringing you about bats at 2 a.m. Do you know what I mean? You're not going to ring me. I'm clear. They're like, Adam's useless. We'll just ring Bolu instead. So we're going to move on to some questions that have been sent in by the listeners of Cat's Got Your Tongue. First off, we've got one from Julie, who sent us a voice note. Hello, Julie.
Hi, this is Julie. Just contacting you. Thank you for your great show, by the way. I'm loving it. Just contacting you. I've got 2 cats who are litter mates, and they get on really well. One of them knows, greedy little thing, bless him. He always tries to steal the other one's food. I've tried lots of things to slow him down, tried feeding in different rooms. Doesn't seem to help. It's quite difficult to do in a small place. If you've just got any tips to help, that would be great. Thank you.
Do you know what? It's nice having a behaviourist on the other side of the corner, because also there's a lot of things I say that, okay, I've used them to help me in consults a lot of the time. And a lot of the time, what's nice about veterinary medicine is multidisciplinary. So we always can lean on each other. And as much as I do all these other things, there's times when I'm like, okay, it's nice to have like a behaviourist and back up a lot of the things that you're saying. One of the big things I say is that cats aren't necessarily familial feeders. It's not a thing for them to be like, it's mealtime, let's all eat together, let's all sit down and have a meal. It is very much like there's almost this kind of, they can become quite protective about resources, and so it's like, okay, it's the food, and that's why sometimes you get the cats that, when you give them food, they wolf it down really quickly. And often when you have one particularly greedy cat in the house, they'll see the other cat's food and I'm going to wolf mine and wolf yours, and it's gone. And so sometimes I discuss with carers about having feeding stations. So multiple feeding stations, so having separate feeding stations within the house, so that cats like their territories, they're territorial, and sometimes there's places where they spend more time in. And so it's always nice to section a part of the house for one cat, and that cat has a feeding regularly in that area, and the other cat has a feeding in another area. Now, if you've got a particularly greedy cat, they can be particularly stubborn and go in their area and go in someone's area. Now, another way to combat that could also be knowing their strengths. So one cat might be more agile than the other, so maybe feeding at a higher stage than the other. So maybe a bit more of a vertical feeder so the fat cat can't.
The greedy cat can't jump up.
Because the greedy cat is usually heavier, so he can't jump. He can't jump as high as the agile cat. So that's another one, feeding them at different things. And then the simple ones where the 21st century is kind of coming is you can get these radio frequency collars which respond to their microchip, or respond to certain magnets around their collars, or things that they have. And basically it signals for when it's time for the cat to eat, and that only that cat can have access to that bowl or that feeder, and then that feeder dispenses the food, and then it kind of helps a little bit. But then sometimes that could also lead into resource guiding as well. But it's another way of separating the portions, because we get this question a lot just because of cats that have different diseases. And feeding cats with different diseases, it's really tough, because say you have a cat that's obese and you're getting it on weight feeding food, you don't want the normal sized cat to have the weight feeding food as well, or the cats that have urinary food, or upset tummy food. You don't want them all to always mix, so sometimes it can be quite difficult. So those are the kind of things I recommend: separate feeding area, dynamic feeding, so challenging each other, and then the radio collars, I think, is a really good one.
You sometimes see those ones where it can it slows the feeding down. Would that be maybe something they could look at?
Yeah, so again, I'd probably do that on the cat that's the one that's very food motivated.
Yeah, that's it.
It's my polite way of saying greedy. And with feed enrichment, you need to build up slowly. So everyone goes in straight for the puzzle ball. And don't get me wrong, I love a puzzle ball, but it's more medium level. So you need to start off easy with a cardboard egg box. Most people have got one lying about. And then you put the dry food in where the eggs would normally sit. If you've got a cat that really isn't particularly bright, you do need to put the biscuits on the flat lid. I've had a few like chunky-faced males that are just like, I can't do this. And so you have to start off really basic. And then you have to work up for the cat's individual pace. Because what you don't want with a greedy cat is getting frustrated. And then they'll just get bored and go straight over to the other cat. You want to keep them mentally stimulated, slow them down, and then hopefully that will help. Along with you were saying about the feeders, the microchip cat feeders are really good. They're a bit pricey, but it's really good. You do have to train them how to use it as well. I have done it with my own cat because we trialled it. But
Are you're not showing them. Are you like crawling?
You're not eating. You're not He's like, I have to go there and eat it.
I don't know why, but I thought you were just like going, are you watching? This is what you need to do.
Look at me.
I mean, to be fair,
I would have done that.
you do have to train them with the feed enrichment as well. But what I say is I pour it out with my fingers, the biscuits, and then I give it to the cat to eat. And also my other tip is only do it for a couple of minutes, because when I first gave this advice out, I failed to say that. And this person was like, oh, Nicky, I've done what you said. And I've got down on my hands and knees actually with a puzzle ball for 2 hours now. And the cat just follows me and eats the biscuits and doesn't understand. And I was like, oh, no, they do understand.
They're
Getting you to do all the hard work. Exactly. So now I'm like, 2 minutes, show the cat to do, let them have a couple of biscuits, let's stand back, let them have a go. With the microchip feeders, that does come with instructions on how to train a cat to get used to it, because it's got like this archway over the top, and that's the scanner that reads the cat's microchip in the neck, and so then it will let that particular cat in, because then it's got a cover on the bowl and that opens up.
Yeah, I've seen them.
So that's like just another option.
Just be warned as well that cats are really quick at picking up enforcement. So like they really understand reinforcement and conditioning. So when they hear a beeping sound or something like that, that becomes the cue for it's like Pavlov's dog with the bell on it. So they will, especially if you have a particularly food motivated cat and you're trying to do the whole section them off, he might start getting accustomed to the sound of the other cats, like microchip going off. So like just be aware of it, where they are and all that sort of thing. But
Definitely. And like you were saying earlier, a little and often feeding, and that might sort of help that cat that's feeling a bit greedy just to keep their blood sugars more stable throughout the day and less likely to try and mug off the other cats.
There's a kind of a similar kind of question that's coming from Claire on Instagram, who says, hi guys, our cat was a stray for 1.5 years. He's so loving, but he gets so aggressive over food. Can we calm him down? So I suppose, like Bolu, what you were saying, that there are certain cats that are greedier. Is there anything that you can do to kind of stop that behaviour almost, not just in terms of changing the way they eat? Is it something that's sort of ingrained into them? Is it more of a, if they've been a stray, I suppose, they probably have to be more, they're fighting for the food a little bit more on the streets, I think.
Resource garden again, it's that resource garden again. And trigger, you said behaviour, so like I do kind of want to let Nicky go, Nicky, you take it, and then I'll pick up anything if I can.
So it is a really common behaviour we see with stray cats. One of the biggest reasons for cats coming into Cats Protection's care is having strays. So we see this behaviour frequently. And I think it's just that experience of not knowing where the next food is coming from and getting quite stressed by it. So, as Bolu said before, food's really important for survival. It becomes even more important when you've been a stray and you haven't had the buffet. Yeah. So it does take them time. So I think it's worth knowing. It takes time, but the cat will generally get there. What I would say is you want to almost devalue food in a way. So again, back to what you were saying about having the feeding stations. I would have multiple different feeding stations across the home. So they've got it in several places, not just one place. And also it stops them going to the new owner for food and making them a focus of it. If they can go to different places and bringing in a little bit of enrichment to give mental stimulation, that can help. And I will come over to you for this, but to see what you think. Changing the diet as well to some. Yeah, I was going to say, but I'm happy to see what you think. Okay. To something like a satiety type diet, where it sort of keeps them fuller for longer, but it's not quite as high value necessarily, like not super high palatable. Yeah. Because again, it's reducing that value. Yeah. Would you agree with that?
100%. I would definitely agree with that. Now, diet changing is always difficult with cats because cats are notoriously stubborn when it comes to like food and things like that. I think you sometimes have a bit of a better chance when it's a stray cat because they're often not fussed where their meal is or what their food is. And also that's another good time to introduce the puzzle feeders as well, because stray cats tend to be a lot more resourceful in figuring out how to get the meal. Yeah. So they're a lot more onto it. So even if you introduce a puzzle feeder to them, then that slows them down and maybe they can become less aggressive when there's more food around as well. But then, like you said, changes in diet affect a lot more. So when it's not that, because to understand the psychology of why they need to shove down their food is because it's like this highly calorific food. I'm going to shove it down quickly, get full really quickly so that I can live for a long time without food, right? It's like us eating a bunch of Jaffa cakes on the sofa because it's like, full of calories, I won't need to eat dinner, I won't need to, or whatever. So it's easier to eat.
Sounds like my Friday night.
Exactly. And then, but when you give them something like the satiety foods are made in a way so that it's a little bit richer, but not necessarily, it's not necessarily like the most addictive kind of food, but it satisfies them on a small amount. So once they eat it, they're like, oh, okay, I'm full, like, I'm done. I tap out. Like, you know, it's like, I try to explain to people like expando food. It's like, you know, you eat it and it just it fills up the stomach and it's like, full. It's like magic. So they're super full, and then they probably won't worry about food being elsewhere. But the multi-stations is also a really, really good point. The fact that you have multiple food stations, and that way, because it's abundant, they're not necessarily like fighting for it. And also, when I say multiple food stations, I try and say, like, you know, measure their 24-hour allowance
across all those stations.
and then put it across the stations. Don't necessarily have like unlimited
like
bowls.
Buffets.
Exactly. Several. Oh my God, there's 7 all-you-can-eat buffets.
Basically, get the all-you-can-eat buffet and spread it out.
It's like one of those restaurants where there's like unlimited buffets everywhere.
And it needs to be sort of upstairs and downstairs, ideally. And then the key thing that most cat owners don't know, and I didn't know until I joined Cats Protection, is having food bowls away from their water bowls.
Oh my gosh! Oh, don't let me go into this. I say this so much.
I know, isn't it like the key thing that every cat owner needs to know, right?
Oh my gosh! Can I just? Please.
Get it off your chest.
He's passionate.
Oh, I trigger this so much because people. I'm always like the number one thing, because when somebody comes to the vet practice, I ask them, is it eating okay, drinking okay, urinating fine, passing feces fine, any vomiting or diarrhea? That's like my standard, right? And then drinking, I'm always like, is he drinking okay? And then it was like, I'm not sure. I'm like, haha, I got you. And I'm like, because most people they say that they've never seen their cats drink. I'm like, where'd you keep your water? And they're like, next to the food bowl. And I'm like, well, actually, like, it's very common for cats not to drink water, especially when it's next to their food bowl. Some have said that it comes from like an ancestral thing of like, you know, when they kill a prey and if it's next to the water might be contaminated or that sort of thing. So it's better to have it distant. And that's why cats like running water as well, because it's not stagnant. So there was more chance of survival if you're drinking running water. So if you're drinking water from a stream or a tap or a fountain, which is why we talk about fountains and taps and drip, drop, bottle droppers.
Moving water.
Moving water. Yeah, exactly. So having that water around, and then also multiple different places of where they can drink water. Because most time, people who say that they don't see their cats drink from the water bowl, it could be because the cat's drinking from the tap, could be drinking from the toilet, could be drinking from the vase, could be drinking from a glass that you leave on the side. They're doing that. But if you set up multiple stations for them, even if you just deliberately leave your glass full of water out, they will probably drink from there rather than the one next to their water bowl. So, and you have,
my cat. She likes like the novelty of it, I think, as well. You know, if there's a new cup out.
This is it.
Yeah, and she drinks out of cups as well. That's just something we established on this podcast.
They're so intelligent, and they really enjoy that. And it's also, you have to also remember as well, and we'll come on to this again later on. I know we'll probably, but like everything with cats is so tactile.
Yeah.
Right? Everything is about a lot of touch. There's a lot of the world that they're experiencing that we're not experiencing, right? And you think about those massive whiskers on their face, has a lot of sensory information for them, and it provides a lot of information for them. So when you have a certain type of bowl next to their food, or even if you're feeding them from a certain type of bowl, that can cause stress itself, just because of like the feelings that they're getting from the sensory feedback that they're getting from their whiskers touching inside the bowls can sometimes be opposite from what you're intending. So it's not pleasurable. It's actually quite disincentivizing. I don't know if that's a word, but de-incentivizing. But yeah, like, you know, it turns them off. And so sometimes having different bowls, a dish for them to drink water out, a vase to drink water out, you know, it helps. Yeah. And then they can figure out what they like the most. So,
that's because I think I mentioned it on a previous episode that, you know, I had a bowl that was, you know, went and bought a bowl that was, you know, really expensive. And I was like, I want her to have the best bowl that she's going to drink out of. Not interested. And she drinks out of a smooth radio cup now. So, you know, you know what I mean? And that's the one she loves it. And that's the one that, like, that's her favourite cup. And I've tried other cups as well. And she's got a couple of, like, and they're just a mug, just a standard mug. And I always thought to myself, well, are her whiskers not touching the side of it?
They don't.
But
so the whiskers actually touching. They don't actually mind that bit, right? It's just it's like us, right? So I have a thing against polystyrene. I hate the feel of polystyrene. Yeah. Some people hate the feel of balloons. Some people hate the feel of cotton, or like, you know, the Q-tip cotton buds kind of thing. Some people hate that feel of it. It's a personal feeling, and for cats, they have to have that personal feeling, that experience for them to figure out what it is. Some cats are fine with stainless steel bowls. I don't always recommend them. Sometimes, some cats love it. Some cats will take a ceramic bowl just fine, and plastic bowls are probably the worst because you get all these chin acne and things like that. Bacteria are difficult to clean. But like,
it tastes the water as well, makes it taste different.
Exactly. So it's all those things. And have you seen the cat that tastes water? That tries water. Have you not? It's all over social media. There's a cat that's like a water connoisseur. So
isn't that every cat?
No, this cat is like he's on it. He only drinks like Evian, like like the owner will put in like different types of water, like smart water, and the pH of 6 and 7, and he only ever goes for the one that, because it's that tactile. They're really down to a fine tea of like, I can smell it. I can smell the alkalinity or the acidity of this water, and they'll go for it. And sometimes it's that the taste of the water and the bowl that you put it in has that effect.
Yeah.
So.
And because they are so particular, aren't these animals? That's the thing. So I suppose it does make sense to actually give them the opportunity for them to kind of tell you what they prefer, and then just kind of take it from there.
But their senses are all geared up to being particular. That's the thing. They're
not just being awkward. It's just the design like that.
Yeah, like literally they're designed that way. Like I've got a terrible sense of smell, and cats are amazing, and they can detect all sorts. So it really is trying to understand them as an animal and how their bodies and everything function. The other thing I want to say, particularly for stray cats, but it applies to every cat, and I want everyone listening to go home and try this, is move the food bowl and water bowls away from the wall. Now, don't get me wrong, some cats, because you're saying it's an individual preference, but most cats will prefer to have the wall behind them, then the cat, and then the bowl immediately in front of them. And that way they can view their surroundings and feel safe that nothing can come up behind them, which for a stray cat who's been having to live off their wits, probably make them feel a lot more safe and secure whilst eating and drinking, because it's quite vulnerable having your head down to eat and drink.
Yeah, and you can't see what's
coming up. Yeah, exactly.
Oh, that is. I could go.
Like literally, like just eating and drinking the episode.
I could just keep going on for days. Like, you guys are triggering me off, but like it's like the idea of safety for cats is so important, because you have to also realize that cats are predator and prey animals. They're both. Right, and part of that is being hyper vigilant. They're hypersensitive to their environment, and so there's a lot of things that we do sometimes that we don't realize we're affecting, like that residual, that inherent behavior from them. So, like sometimes when we're giving them shelter, sometimes like the biggest example is a covered litter tray. Sometimes a covered litter tray doesn't always work for all cats, because there's that fear of like, I can't tell what's around me. It's like being in a tent in the middle of the woods.
And you've got a small hole to put your head out through, like the danger hole.
And then you see glowing eyes outside, and you're like, whoa, it suddenly makes going to the toilet a lot quicker, but also harder for cats. But yeah, it's that kind of thing of like, you have to be aware that they are predator and prey, so they want to be vigilant. They want to be aware of it. It's that sort of thing of like, when pets go to the toilet and they're kind of looking at you, it's because they're in a vulnerable situation. They're like, I hope you got my back, because if something happens now, I can't do anything.
That's why I like to think of cats as spies sometimes, because in that hypervigilant state, you think of the sort of James Bond, where they've walked into a room, they know all the exits, they've already clocked who the dodgy people are.
That's it.
And that's how cats function. That's their world. They come in every day and they're just like, right, got to be aware of this, got to think about that.
And you think about, sorry, I'm just going to keep going.
Go for it.
But you think about that and you're like, what does this mean in terms of stress?
Yeah.
Like, what is it like? Because you think about us as people and the amount of like stimuli you take. Like, if you're somebody that's not necessarily great at walking into a busy room or like going into a massive train station, and all the information is like, you get this sensory overload, it's stressful. And it's the same thing with cats, is that they've constantly got this bombardment of signals and information. It can be so stressful for them. Like that can be stressful. And this is why cats are so prone to stress. And stress is probably like the number one cause of a lot of the diseases I see in practice. So if you find ways to minimize their stress, simple as moving their food bowl away, as simple as moving the food away from the water, as multiple litter trays, multiple feeding stations, regulating the other cats, then they start to live longer, happier and healthier lives. So yeah.
We've got an email from Hannah now who says this. You're going to love this, Bolu, because I know you're in. Honestly, put it this way. It's about teeth.
Oh, get me involved.
So I knew this is right up your street, this, mate. So basically, Hannah says, the vet said at my cat Midnight's most recent 6-month checkup that her gums are a little red and that we should clean her teeth. So Hannah got a toothbrush and toothpaste for her, but she's not used it yet because she feels like the cat won't enjoy it and she don't want to cause her any undue stress. So any advice on how to make it a nicer experience? I mean, first of all, are you happy that she's taking.
I'm loving that she's
yeah.
taking dental care seriously in a cat. Like, we need more advocacy for feline dental care, and I'm going to keep screaming it from the rooftops. How old is Midnight?
It doesn't actually say how old she is.
Okay, well, I'll just go through all the stages.
Oh, here we go.
No problem. No problem. But okay, so redness inside the gums, we call it gingivitis, same as in people, right? And it can be for a number of different reasons. It could be because of bacteria, it could be because of genetic, it could be, there's so many different reasons as to why there could be that redness, soreness. I mentioned it earlier about them having resorptive lesions as well, that could cause that redness in the gums. And that's where, as vets, we have to quantify what that redness means, right? Now, if they have redness on the gums, let's say in their first year of life, the first 18 months of life, often it's unlikely that they have really bad teeth. It's unlikely they have like dental disease and secondary bacterial infections, things like that. It's more likely because of either genetic conformation, so they either have too many teeth that are causing pain and swelling around the gums, or they have mismatch of teeth, so they might have like a mismatched bite or a cross bite or things like that, so that's causing pain and swelling in the gums. And then also there's another thing called juvenile gingivitis, okay? Juvenile gingivitis is one of those things where young cats, they get gingivitis and super inflamed gums because in a way they're almost allergic to their own plaque and their own teeth. Almost if I really simplify it, they're not fully allergic to their teeth, but it's the bacterial makeup of their plaque that it causes allergies and makes their gums really sore. So juvenile gingivitis. Now, sometimes juvenile gingivitis can also be immune mediated. So their immune system starts to attack their gums and makes it really painful and sore, and that's where you get that redness. Now, if we are trying to combat that, sometimes as they grow older, the juvenile gingivitis goes away as they age and they get used to their teeth. But in some cats, they may need what we say like full mouth extractions, where we take out all their teeth because they're essentially having an allergic reaction to all their teeth, and so they need full mouth extractions. That's one side of it. Other side of it is dental care, so like brushing and staying on top of it, because if you have the good dental hygiene, then you can get rid of it. I forgot to mention as well that sometimes their teeth can be red because they're just changing teeth. Their adult teeth are coming in, right? So when they're young, if you're seeing that redness in their gums, often, talking with the vet and things like that, you want to make sure that it's not juvenile gingivitis and it's not a point where we need surgical intervention, and then brushing helps. Now, when you're brushing them when they're young and they're less than, this is really young now, if we say like 6 months, that's the best time to like get them accustomed to it, habituated to it, even earlier than that. But if they're 6 months, you still got a bit of a chance to kind of like, get in there. And I usually say, use your finger first. Well, in fact, before that, just get used to just opening their mouth, prying their mouth open, and then let them run away. Or reinforce that behavior, right? So a lot of things are positive reinforcement, positive conditioning. So maybe touch their mouth and then give them a treat afterwards and be on your way. Or before they get their meal, let me have a look in your mouth and fiddle about, and then let them have their meal. Just lifting up a lip, just getting them used to you just handling their mouth, right? That's the best way to start off, is just kind of like fiddle about their mouth and then give them a treat. Do this for about 2 to 4 weeks, yeah? Because it's just a long time for them just to get used to their mouth. And then after a while, it can be introduce your finger into their gums, into the sides of their gums, right? So it's like kind of shoving a finger down the side of their mouth whilst they're comfortable with you kind of playing about their mouth. Sometimes I even say whilst they're half asleep, when they're in that twilight zone of kind of waking up, maybe just like gently wake them up by, caressing around their mouth areas there. And then if they get a bit too like, oh, okay, no, then let them be, but just get them used to that. And then after that, get used to having the toothpaste. Now, it's very important that when we say there's toothpaste for cats, there's toothpaste for cats. Don't use human toothpaste.
No. Or dog toothpaste.
Yeah, exactly. Because there's fluoride, zinc, titanium, all these different things that shouldn't necessarily be in certain toothpaste, especially for cats, that can be poisonous for them. So
don't whip out the Aquafresh. No.
Yeah, exactly. None of that. There's veterinary equivalents for them, so you can get the veterinary cat toothpaste. And there's a place that you can go to get them. It's the Veterinary Oral Health Council. If you search the Veterinary Oral Health Council online, it has a table of all the toothpaste and like teeth stuff that you can use
all
for
the
cats.
safe ones.
Yeah, exactly. Finger in the mouth with the toothpaste, and they get used to, or just even show them the toothpaste. Let them lick the toothpaste off your finger, and then let them be on their way. Yeah. Then getting used to that, and then you can either get so you can get different types of toothbrushes. You can get the finger toothbrushes, which you put on top of your finger, and you can brush your teeth with. You can get these like multiple headed toothbrushes, so they have like 2 or 3 heads on them, and you can brush your teeth with that and introduce them to that. You have single head toothbrushes specifically for cats, or you can just get a baby toothbrush, soft bristle baby toothbrush, and just get them used to that. And sometimes you can brush around their mouth, brush around their face, let them chew off the paste from there. Sometimes you can replace the toothpaste with like pate or fish paste or whatever, so they can get used to just crunching it, because cats will happily crunch and stuff. Yeah. So they'll just like kind of crunching it a little bit, and that's in a way getting them used to brushing. And whilst they're crunching, just kind of give it a little shimmy inside them.
Yeah, just so they get used to that movement and that
exactly.
that sort of that connection, I suppose, in terms of having something in the mouth that you're in control of.
Exactly, and that breakdown over a long period of time gets them kind of used to it, but you have to kind of do it over a long period of time, and that's for the juveniles, and for like 6 months up until about 18 months, you can kind of get away with that. As they start getting older, I think once you get past adolescence, you start entering into that like, adult phase of life, and especially when they're geriatrics, it's really important just to double check that they have full dentistry with the vets. So maybe book them in for anesthetic. Even if the vet doesn't recommend it, just say that you want to book them in for a scale and polish, just to make sure you can check all the teeth, because it's important we do dental x-rays to see what's below the surface and make sure there's nothing else going on. And a lot of people don't want to do that because of the expense, but if we do it, then we can see that, oh, actually this tooth needs to come out. So, because there's no point brushing your tooth if it's like rotten below the surface, right? Because it's just going to cause pain. And that's probably why they don't want you to brush their teeth, is because they're in pain. So it's worth getting that checked. So after that, once they get into adolescence, after 18 months, make sure you're getting their teeth checked. And then after that, if they're really, really, really still not wanting to brush their teeth, there is dental food that you can put them on. Dental food, the way it works is that it has a specific balance in it so that the pH of it isn't conducive for bacteria growing on their teeth. So the plaque doesn't build up on their teeth. That is basically like, so basically this magical food that means that plaque doesn't build up on their teeth and doesn't cause the issues. And it's a little bit easier it's easier for them to bite and chew and all that sort of stuff. And it's made in a way so it kind of scratches their tooth, blah, 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 blah.
Yeah, I think I've give my cat Ruby some treats that are meant to have some sort of, they're meant to actually clean her teeth, but I don't know. Again,
this is where you check the VOHC. So if you check the VOHC,
what's that?
So that's the bit I was mentioning earlier. That's the Veterinary Oral Health Council. So Veterinary Oral Health Council.
I'm not cool enough to know the extent yet, but I know now. Yeah.
No worries. So the Veterinary Oral Health Council, VOHC. Just literally type in VOHC for cats into Google, and usually it's like the first link, and they have a table of all the treats that are actually suitable for fighting dental disease in cats. They also do it in dogs as well, but it's like, everything that you need. So, because some companies will tell you that this does the dental, this does the dental work and all whatnot, and you're like, it doesn't really. The VOHC are all the stuff that's generally approved to like reduce plaque, actually clean their teeth, actually do those things. So
because these ones that my cat, she loves them, and they're thinking, that's like me, just like loving Listerine or something.
Yeah.
You know what I mean? I'm like, surely she's not absolutely buzzing off food. So, I mean, again, if anyone has got issues with their cat and, sort of the concern about the dental hygiene and the health, then that's obviously a great website to check out.
Definitely check out VOHC. VOHC.
So we've got another voice note now. We've got a couple more questions just to finish off. And we've got one from Lindsay. So let's hear what Lindsay's got to say.
Hi Adam and Nicky, we are loving the podcast. We giggle and can relate to it a lot. So we have a query we hope Nicky can explain for us. We have a litter tray avoider. So when he was younger, our cat Byron used to use his litter tray. Now he's 8 years old and he doesn't use it anymore and prefers to go outside. So now we just store it away. However, it is becoming a nightmare if we need to keep him in, for example, a trip to the vets or recovery. So, do we need to reintroduce him to it? Thanks in advance, Lindsay, Stuart and our cat Byron.
Oh, I can certainly identify with this, and I think loads of our listeners can as well. So I think one of the things you're picking up on is, he used to have this, but now he doesn't have it anymore. And can you reintroduce it? So yes, you can. And particularly as the cat gets older, which I'm sure Bolu will agree with, it's always good to have a litter tray available, even if they don't use it. And it's particularly important in winter because, cats, a lot of them fair weather. They don't want to go outside and toilet when it's cold, when the ground's frozen over and they've got to dig and it's difficult. So by having a litter tray available, it really helps. Just, help with changing seasons. Also because you never know when they might get sprung upon during toileting by, say, a neighbourhood cat. And so having that option available is really useful. Now, I would say you need to check your litter tray checklist. It is available on the Cats Protection website, written by yours truly.
Did you write it?
Yeah. Well, you know, anything behaviour, I wrote it.
That's a flex.
There we go.
That's a flex. Behaviour, I did that.
Yeah. But yeah, just a few key things on there. One, have a big enough tray. It's no good having an adult cat with a teeny tiny little kitten tray, and they can't fit. It needs to be sort of 1.5 times the cat size. Which for your larger breed cats, for example, you may not be looking at a litter tray. You might want to look at like a large storage box, for example, and you cut down one of the sides so they can get in and out easily. As cats get more mature, you need to be thinking about an older cat litter tray. We do have one available on the Cats Protection website. And that has got that front side cut right down so they can get in and out. Because, you know, we've talked about cats and arthritis and pain being really subtle. Some of the signs are that they just don't want to get over that sort of few inches to get into a tray, even if they're still jumping on the windowsill. So very subtle. So that you need the right tray. You need it in with the right litter and the right amount. I know so many people that have tried no litter with their cats. But it needs to be, the average cat likes 3 centimetres of soft, sand-sized litter, very fine, because that's what they have, the wild species of cats have out in the wild. Yeah. And certainly when I've been abroad, crazy cat person abroad, and I've been like, oh my God, it's literally like a litter tray everywhere. and it is because that's how they've evolved to have this sort of fine sand style litter. So that's what they like, and they want to get in there, have a really good dig, so they don't like it too shallow. And then location. It can't be near the food bowl, water bowl. Everyone puts them next to cat flaps because they say the cat wants a loo with a view. They don't. Just like us, we don't. You know. I mean, not unless you had like some posh pad somewhere where no one can see you. Yeah. But like, you know, there's a lot of similarity between people and cats and their toileting habits, and they want that privacy. But for those that do get privacy, a lot of people miss accessibility. So I've known people put cat litter trays inside wardrobes, for example, and then shut the door, and then the cat can't access it. And the same for like certain putting in the room, but then shutting the door and they can't get in. So they need to have somewhere private, quiet, and definitely not overlooked potentially by other cats. So not away from cat flaps, away from glass patio doors, definitely not in conservatories. And also away from high traffic areas, both in terms of cats and people. So not on the stairs and not in sort of, you know, hallways and landings and things. So, you know, there's an art to litter tray placement. There are lots of options, and it's about working out what's best for the individual owner, because some people will happily have it in a bathroom, others wouldn't consider it. So it's got to work for the person as well, but particularly it's got to be the sort of the cat rules of where they would want the litter tray. And then, I would definitely try and reintroduce it and see if you can find a litter that works for them, find a few locations. And a bit like with the water bowls, you know, give them a few different locations and then let the cat literally vote with their paws and say which ones they're happy with. And sometimes it's not what you think. Yeah. I've definitely had the embarrassment before where you do all the sensible cat places and then they pick something completely random that's like they didn't read the cat manual, and you're just like, oh, that's a bit embarrassing. But hey, if that works for the individual, that's great. But like I say, work your way through, and then it will hopefully help make those vet visits a bit easier. We've got
another question from Tori, which kind of links in a little bit. And Tori, needs some help. She's in desperate need of our help, in fact. She says, we've got a wonderful Maine Coon cat that's a bundle of energy. He's 10 months old, lives mostly indoors. Sometimes we need to travel for work without him. So they get a cat sitter in, but whenever they leave, he tends to wee on the bed. So she's wondering, is it separation anxiety, or is it like a protest that he's not going with him? And she said they've tried it all. Fell away, feeding him in the bed to disassociate from going to the loo, changing all the bedding, closing off the room, positive, negative reinforcement, new, bigger litter trays, change the litter more often, a shower curtain on the bed. This is the desperation that's happened.
And it's hard. I fully get it, because it's a really, really common problem, first and foremost. Also, going on the beds is way more common than most people realise. Now, just to explain it from the cat's perspective, our beds are higher up, so they feel safe. It comes back to safety, like Bolu was saying. They're nice and soft underneath the paws. They're always clean. And particularly if they've toileted on the bed, that bedding is ripped straight off to go in the wash, so it's refreshed and been clean. And the other thing is, people think it's this protest that they say, that it smells of the owner, and it's actually reassuring to the cat. So actually, it's like
a giant litter tray, basically. Yeah.
But with that sort of reassuring scent of the owners, if you are bonded with your cat, that the bedding smells of them. So Yeah, first and foremost, it's not a protest. Cats don't actually do protest weasel poos. It's a really common misconception. So I'm going to say, first and foremost, vet check, and hand over to Bolu for vet check.
Yeah,
and then come back to me for behaviourist.
vet check for sure. And another big thing with the vet check is when somebody tells me that their cat is urinating places they shouldn't do, I say, how many litter trays have you got? Because the big thing for me on the number of litter trays, like people get so many cats in their house and not realise, I say at least 2 per cat.
Yeah.
Even if they are an indoor or an outdoor cat, just because the fact that cats like to urinate in different places, and like Nicky was saying, you've got to have, the different types of litter. The cats are sensitive. It's a tactile experience. They have to dig around in where they're about to go toilet. You have to touch a toilet seat. Imagine you haven't touched a toilet seat. You want it to be something that you like, right? Yeah, clean. So it's going in there and changing it and making sure it's clean, regular. Make sure you have separate ones in separate places. Also be careful of like highly pungent areas. So like they don't really necessarily always like the bathroom. People's first idea is to put the litter tray sometimes in the bathroom, but because of all the perfume and deodorant and smells, and it's too much for them. So that's another big thing for them as well. And then
get a urine sample tested.
100%. Because once we start doing that, then we know because again, when we were talking about stress before, one of the biggest things with cats is that when they get stressed, they have a lot of nerve endings on the end of their bladder. So when they get stressed, all of that anxiety and the nervous system just reacts on their bladder, and then they get this very inflamed bladder, and that's where we get the lower urinary tract disease, which is the most common thing that I see in practice. Yeah. And that's what we call stress cystitis. And that's literally because they're so stressed, I can't wee. Yeah. And it blocks them, and sometimes it could be fatal.
Yeah. But all those things that we mentioned earlier, if you can eliminate those kind of, triggers that will give the stress and anxiety to the cat, if you can eliminate those, I suppose that becomes less of an issue.
Exactly. Yeah. Exactly that. So it's all husbandry. So just staying on top of that, and you're good to
Definitely.
go.
So rule out medical reasons, and then go seek help from a qualified behaviourist, such as someone from the Animal Behaviour and Training Council.
We've got 2 more just to round things off. We've got another voice note now, and this one is a really important topic to discuss, actually, I think, in terms of cats. This one comes from Robert. So let's see what Robert's got to say.
Hello, my name is Robert. My beloved cat Basil recently passed away. I feel terrible about it, and while everyone keeps saying it was just a cat, I'm still struggling. Do you have any suggestions for me?
Well, I lost the cat last year. It was I'd never. Well, it's the only pet I've ever lost, and I can really identify with what Robert's saying there. The grief was just like something I'd never experienced before, and I felt. I was chatting to you about it one night, Nicky, and I felt this real kind of strange guilt because I'd lost family members and I'd not had the same level of grief, and I struggled with that for a long time. I thought, I feel bad that do I care more? It's not about caring more about something than not. I don't know if it's something to do with the bond that I had with the cat, or I think it's because when you lose like a member of your family or a friend or whatever, sometimes you expect it. And it's that kind of, like lose a grandparent who might be old or has been ill for a long time, but losing the cat was just sudden. Yeah. So for me, it was like, I'm not prepared for this at all. Like, oh my God, like, how do I deal with it? So I kind of see, and people, I think when I was speaking to people who weren't cat owners or didn't understand, they were saying like, why are you crying over a cat? It's just a cat. No. And I'm like, oh, it's not though. It's really not. You just don't understand. Yeah. So I think it's difficult. For me, it was being able to look at videos and pictures. I couldn't do that for a couple of weeks at first, but now I think for me that mindset switched from being sad about looking at the pictures to actually being happy and realising how much of an amazing life she had and things like that. So that's how I dealt with it. Initially a few weeks, but actually now, rather than shunning the things that I thought were going to make me sad, I've actually got to the stage where I can reflect back and watch videos of me stroking her and her sat on my knee and that kind of thing. So I don't know what you guys kind of...
in the vet world, like grief is like a huge thing that we have to play with, but deal with. Like, it's something that we're dealing with consistently. And as he was talking, as Robert was talking, I feel it because I get a wave of everything. I remember close to almost all like end of life positions that I've been in, and when we go to euthanasia and we're talking about helping cats get to the other side, it is like, it is really emotional time. And often that stuff impacts me a lot because I take a lot of it home. I still remember every family. I remember all the emotional cases. I remember what the cases were. I remember if there's things that we could have done more for them, or is it too soon, or is it too late, or all those sorts of things, and all the conversation that we had and the questions that people ask me sometimes, because I almost get like put in the hot seat.
It's
of like,
massive pressure though, isn't it? Because those animals mean so much to the owners.
Exactly, and weirdly enough, they mean so much to me as well when they come in, like, because that's part of why I do the job, right? I'm trying my hardest to look after as many animals as possible. And the thing that helps me a lot with grief and grieving and processing it is you kind of just have to, like, there's nobody can tell you how to grieve, first and foremost. Nobody can really tell you, but you kind of have to sit with that emotion just for a little bit. Like, it sounds cliche to say, but time heals a lot of things. And I know, because when I lost my dog, it was the hardest thing as well. And like, I start welling up as well. And I put her to sleep myself. And it was that kind of thing of, I was bawling for that first, 2 days, and knowing that I was going back to work and she was in the practice as well after I'd really done it as well, and knowing that she was still there ready to be collected was doing me as well. But it's that kind of thing of, you kind of almost have to sit with the emotion a little bit. You have to work your way through it. You have to address it, because when you kind of lock it away, that's when it keeps bubbling up, and it is important to remember that. I say this to every single person. I hope it reaches the people that it needs to reach. But when they come to me and they ask me about whether or not it's the right time, I will always say that the difference between their lives and our lives, right, is that for us, we have a very long life, but cats have we're all their lives, right? They're just a blip in our lives. Like, they're the 14, 15 years of our lives, but we're all they know. And provided that you gave them as much love and affection as possible, all they knew was love, right? For 15, 16, 17, 18 years, 20 years if they're a really good cat as well, all they knew was your love and a really good environment, and they knew care and affection. You hugged them, you cuddled them, you gave them all these great memories. That's all they knew. And they went through those 18, 20 years with just that. And for them to be able to pass with just that, it's really beautiful. That's all that they had a life of love. We do all these other things, and maybe later on down the line, maybe you might be able to like think about possibly getting another pet or something like that. But you gave them as much love as possible, and that's what's important to remember. All the good memories that you gave them, everything good that you gave them, everything you really looked after them for that period of time. Yeah. And that's what's the important part. And death happens. It is one of those things that it's a transitory period, and it has to happen at some point. But, time does heal. Eventually it does settle down. The emotions do bubble up every now and then, and that's fine. There's no need to hide from it. Like, it happens. It just shows how much you cared. Right?
Yeah.
So, yeah.
And also, I think something we often say in vet practice, which I feel a lot of people may struggle with as a concept, but is that euthanasia is actually a gift, and it is actually a final kindness that we can do to animals. And I know as an owner, it doesn't feel like that in the moment when you're really emotional, but that's why it's really good to speak to your vet practice staff. But it is a blessing that we have that option, and we can take away their suffering at the right time. So it's a really brave decision to make, and like I say, I can appreciate it feels so hard, and we've all been there ourselves. But it's good that at least we have that. So just to address a few things for Robert, first and foremost, it sounds like he's not getting enough support. So I think first and foremost, everybody listening, plus me and Adam, every celebrity we've had on this podcast, we are all fully paid up cat lovers. We get it. Yep. We completely understand how hard and heartbreaking it feels. And they're not just a cat. We'll all have different relationships with our cats, but they're all going to be strong relationships. And what it means to the individual, you can't take that away. So what I would say to him is you need to find somebody that gets it and understands. Now, at Cats Protection, we do have our Pause to Listen service. Now, this is a free service run by our volunteers, by people who, again, fellow cat lovers who've been there, they get it, they're specially trained, and they'll just provide that kind listening ear, to help get people through the dark times of grief. So do check out our website, cats.org.uk. We've got loads of other support and advice about how to help with grief. But also just finding a fellow cat lover, in your community, whether it's, friends or family or somebody, because particularly for the grief I've been through, I find that if you can just speak to someone else who gets it, who's been there and gets it, you just can't put a price on that at all. Yeah. And it really helps to have the shared experience, the knowledge that your emotions are, perfectly normal and standard, and that's okay. Like you're saying, to sit with those emotions, work through it, and talking is so important. It really is. You can't underestimate. Just keep talking about it, and as you sort of work through grief, and I won't say get over, because you never do get over grief. It becomes part of you. And you sort of grow around it, as it were. But it's not going to be as raw as the early days. So time does help in that respect. But if you can keep talking about it and then eventually get to a point where you can look at photos, or you can think of a way to have a sort of memorial for your pet, or some way of, acknowledging them and remembering them, that can provide comfort for some people as well. And it's going to be different for every person. Yeah. But I think, that's why people have funerals, and it's not for the person that's really died. Ultimately, it's actually for everybody left behind. And it's a part of a process to help us acknowledge what's happened and help to make sense of it in some way. And obviously, like, how the cat dies will really affect how the person feels as well, as to whether it was, the cat had a long life or not, whether it was traumatic or not. But like I say, if you can just find the people that get it and keep talking, keep having that support. And other little things like self-care. It sounds like a really basic thing to say, but it's one of those things that when you're grieving, it can easily go out the window. So just little ways of looking after yourself, getting out into nature is a real healer, having some walks and getting some fresh air, and just little things to make you feel happy.
Yeah, even just as simple as taking a shower.
Literally, that's what I meant about self-care, was shower.
Just shower, because sometimes
brush
you sit in bed. Yeah, literally, just I brush my teeth today and I'm going back to bed. But
then that's it.
Yeah, you did it.
Tick, achieved. And like you say, just little things to look after yourself, because it's so easy when you're in the depths of despair.
It's tough.
And I think as well, the key thing is that it will get easier. It does, and like you said, like Bolu, you said there that it's just time sometimes. But in that initial kind of first few weeks, it seems like rough. It seems like I'm gonna feel like this forever. Yeah. That's what I felt like. Yeah. I was like, I feel like there's
your heart's been ripped out.
Yeah, and I was like, is this it now? Like, is this my life's gonna be like this? And then it does. Time goes on, and I think, like I said, for me, it switches from that kind of feeling of sadness, and like you say, you never fully, it never goes away. But now I can think back to
happier times.
Yeah, and I think like, actually it was so amazing, and I'll still see things now and think, oh, I should have loved that, or I remember that time then she did this, or how daft she was, and that becomes a lot easier. So Robert's probably not in that stage yet, but it will come.
It will come, and I think it's good to know that happier times are ahead. One other misconception I want to just address quickly is people that don't get it will always see things like, oh, when you're getting a replacement. Yeah. And there is nothing worse than hearing that, because Basil will have been the most special cat ever, and there is no replacing Basil. He's a one-of-a-kind cat, but that's not to say that you can't welcome other cats into your life at the right time. Yeah, exactly. And there'll be a different, unique personality, different again to Basil. Yeah. So, you can't replace them. They're all irreplaceable.
Yeah.
Bolu, we will let you go in a second, but one.
Let's do double time.
Even though we want to chat all day.
Yeah. Exactly. And this is what it's like. We get a chance to speak about cats, and it's like, right, okay, how long have you got? Like, so one thing that we do tend to ask people on this podcast is, it's quite a big sort of open-ended question, but what's the best thing about cats?
Wow. What is the best thing about cats? I say it a lot. Cats are just like, my go-to is just to say that cats are elite, right? Okay. There's a comedian that says this joke, right? And I can't remember who the comedian is. I just remember the joke because I say it so many times. So I'm not claiming this is my own. but like dogs, right? You feed them, you clothe them, you give them shelter, all these things, and you protect them. And they say, wow, you must be God. Cats, you feed them, you clothe them, you give them shelter, you look after them. They say, wow, I must be God. As in, cats have this mindset of just like it's their world and we're just living in it, right? And the more you look at them, the more you start to realize that they understand the world and we just like, they understand life, they get life. When you see a cat, like you can't help but to be envious of a cat, like especially when you go to like another country and you see them like lounging around, especially when you see all the strays everywhere and they're lounging. You're like, you guys have got it sussed, man. No mortgage and you're just chilling. Like, why am I chasing after you? We have a whole podcast dedicated to cats. Nobody's dedicated a podcast to me.
I'm worried about putting the bins out.
Literally. So I think it's just that elite mindset. I think the mindset of a cat is the best thing of a cat, and I think that is it in totality.
Amazing. Bolu, thank you so much for joining us on Cat's Got Your Tongue.
Thank you so much for having me. Amazing.
Yeah.
I like a little trio. I think we do all right.
Yeah, it's really good fun. Yeah. Yeah, I loved it.
You can set them out.
Oh, I have to keep going. Yeah. I'm like, Nicky, tell me
I was literally like, a whole episode of list trays, whole episode of like.
Oh my god, we have to do a whole episode of list trays. List trays needs to be talked about more.
I know.
It really does. Oh my gosh, there's so much to talk about. I have to keep going.
Alexa,